mom of a little baby boy.
Hi, I'm Renda. I'm a board certified OBGYN and I'm also Rachel's mom.
And this is the Mama Doc Baby Doc podcast.
So, Mama Doc Baby Doc podcast is here to support parents from the preconception stage through to parenting. And we address common concerns, offer expert advice, share relatable experiences to help new parents navigate pregnancy, childbirth, and beyond. And today we're in for a really special treat because Rachel is going to share her birth story with us. And I am so excited, Rachel, to talk with you about this.
Yeah, it was an experience. It was pretty crazy.
They usually are. They're usually not quite exactly what we plan, but that's okay.
No.
So I'm excited to get into your birth story. So why don't we start? Why don't you tell us what was your plan exactly?
I laugh. But anyway, so my due date was March 12th. And, and just talking to everyone, I was thinking, it was my first baby. I would probably go the full 40 weeks, if not longer, if they would let me go longer. And in talking with my OB and everything, because of my age, I'm 36, so I'm considered a geriatric pregnancy, old lady. They wanted to deliver me at 39 weeks. So we had a scheduled induction planned at 39 weeks.
Yeah, that's really common for women who are a little bit older. There's lots of that makes you a high risk pregnancy just because of your age. So there are just more complications that can happen. Higher risk for blood pressure concerns, higher risk for gestational diabetes, and also just being older age. There can be more issues with the placenta and the function of the placenta. And the placenta is what filters your blood to give your baby food and oxygen, and that's super important, right? So it's pretty standard practice and recommended by the American College of Obstetrics and Gynecology that women who are advanced maternal age or geriatric pregnancies, as I think we're calling it now, to consider an induction of labor at 39 weeks. So that's why your doctor recommended that. Yeah.
Yeah. And, I was totally fine with that. I was fine with having an induction. I know some people would prefer not to, but I was totally fine with it. So we went ahead and scheduled my induction a week before. My doctor was on call on the Thursday before my due date. So we scheduled me to come in at 8:00 at night on the Wednesday night. And, I figured I would go the whole time. Spoiler alert, I did not. But I figured I would go the whole time to 39 weeks because it's my first baby. So I scheduled to work. I had patients up until, 2 days before my induction day. So
yeah, and I had plane tickets, right?
Yeah, and I had scheduled family to come in. You guys had plane tickets,
right?
And I really wanted you here for the delivery. That was really important to me. Even though I am a doctor and I've done OB rotations, seen a million deliveries. I just felt more comfortable having you there, someone who's been through a million deliveries and could walk me through things. It's always different when it comes to you, when you're the patient, even though you are a doctor. And so I really wanted you there. My husband is a CRNA. I'm a pediatrician. You're an OB. So we were all joking that all three of us together, we could have this baby by ourselves. We didn't need anybody else.
Of course,
which is kind of laughable now because we really had no control over anything that happened.
Right. And you never do, just so you know. So when did you first realize that your perfect plan, your planned induction at 39 weeks was kind of going off the rails?
Yeah. Well, everything really was going so well in my pregnancy up until 39 weeks or 36 weeks. I was having, those regular appointments. There was no sign of him coming early. I was fine. And then I was only 3 weeks away from induction at 36 weeks. And, I felt like I had those 3 extra weeks, so I did not have anything ready. All of his
We
stuff
talked about
was,
this, Rachel.
I know, I know, I know. All of his stuff was still in the boxes. I hadn't thought even about what to put in the hospital bag. I didn't have a birth plan. I still had 3 weeks. 3 weeks is a long time. And then I went to my OB for my 36-week appointment, and my blood pressures were high. And she said that she'd kind of been watching them because they had been going up and up since my first couple appointments. So she had me lay in a dark room. We did a non-stress test, and she rechecked it. It was still high. So she sent me to the hospital that day for further monitoring and testing to OB triage. And in OB triage, I was diagnosed with preeclampsia. The OB hospitalist walked in and said, this probably means you have preeclampsia, and you might want to talk to your doctor about being induced at 37 weeks.
Yeah, so preeclampsia can be really serious. So preeclampsia is characterized by high blood pressure, protein in the urine, and I believe your protein creatinine ratio was high, if I remember
It was
correctly.
high. Yes, it was
Yeah.
high.
Women that have that can develop seizures. You also can get low platelets. Your liver can swell. Lots of bad things can happen. So it's not good for you or for your baby. So 37 weeks is actually considered full term. Babies born at 37 weeks do really well. They don't generally have any trouble breathing. They usually feed pretty well. So once we diagnose a medical condition like preeclampsia, it becomes more urgent to deliver that baby. But you, if I remember correctly, were not really feeling anything, right? You were pretty normal.
Yeah.
Good.
I
Yeah.
had no symptoms of anything. I was shocked to find out that I was diagnosed with this. I have friends who were diagnosed earlier in their pregnancy and had so many symptoms, swelling, headaches. But I felt fine. I maybe had a little bit of swelling in my feet, but not horrible. And I didn't have any headaches. I was doing really great. So I was really shocked to find that out. Yeah.
Now, obviously, you were third trimester pregnant, so you were
Yeah,
having yeah.
I was uncomfortable for sure,
Yeah. But
but
there are a lot of people that don't have the symptoms. Now, the
yeah,
symptoms that some people do get that can be signs that maybe the preeclampsia is significant. Like severe preeclampsia, you can have headaches, hyperreflexia, visual changes, pain in the right upper quadrant, which can be from your liver swelling. So when women have those symptoms, then immediate delivery is pretty indicated. Yeah, as soon as we
yeah.
can. Yeah.
Yeah, and I know all those symptoms, and I had been watching out for them, and I didn't have anything like that. So to be 100% honest, I didn't believe my doctor. I'm so sorry, Dr. Hedges, if you're watching this. I did not believe her. I was like, there's no way, this is not true. And when she came in and told me you might be delivering at 37 weeks, that was 5 days away from that day. And as I said, I wasn't ready. I had nothing. So I was pretty shocked and not having a good time with that. But, like I said, I had no symptoms of anything, but I did have high blood pressures that turned out to be pretty real. They were real high blood pressures.
This is why prenatal care is so important, right?
Yeah.
This is why it's important to check in with your doctor on a regular schedule, right?
Yeah, for sure.
So blood pressure, high blood pressure. Typically what your doctor is going to be worried about is a systolic blood pressure of 140, so that's the top number, and a diastolic of 90. If you get above 140 over 90, you really need to contact your doctor. Now, a lot of women don't check their blood pressure at home, so your doctor is going to check when you go in, or your midwife, or whoever you're seeing. But you can also get a blood pressure cuff and check it yourself. Especially women who have a history of high blood pressure, they're super high risk for preeclampsia. Or even if you have a family history, it's something you might want to consider. Now, obviously, when you're active, when you're exercising, if you go up a flight of stairs, if you're really nervous or anxious, that can cause your blood pressure to go up, of course. But your blood pressure shouldn't be consistently high. When you're resting, when you're sitting back in a chair and at rest, your blood pressure should really return to normal. So your doctor saw that your blood pressures were high and that in the early pregnancy, in the beginning of your pregnancy, they were pretty normal, right?
Exactly. And just how you said, that's why prenatal care is so important. My doctor from my very first appointment was checking those blood pressures and they were very normal. In the beginning, I looked back, they were 110s over 70s. And
Mhm.
then towards the end, more consistently, they were 130s over 80s, which is a big difference. Like you can tell looking at my chart that they did definitely go up. So yeah, and she also was really good about getting baseline preeclampsia labs at the beginning. So we were
Mhm.
able to see, the labs definitely did show changes. Um, so everything showed signs that yes, it was definitely probably preeclampsia, even though I was in denial for a very long time. um, but thank God that that happened because that weekend we spent the whole weekend kind of getting things ready. John and I did for a possible delivery that next week. Um, we got unboxed like all his bassinet and his changing table, so at least we had a place to kind of take care of him. And I started laying out stuff to take to the hospital. I didn't have a bag packed quite yet, but yeah, thank God that all that worked out, that I was able to have a little bit of preparation and getting some things ready for him the week before. And so kind of what happened was I was talking to my doctor and she had me kind of monitor my blood pressures over the weekend. John, who was, was a nurse, he's a CRNA now, was taking my blood pressure and checking it. And it didn't really get into a severe range. I didn't have any symptoms. So we talked about scheduling an induction for the next week, even though I told her I don't want to do that, please. But we ended up scheduling it for that next Thursday. And she said, you can try and make it to closer to 39 weeks, but I don't really feel like you're going to make it. She said, my spidey senses are telling me you're not going to make it. And I remember thinking, you're crazy, lady. Like, of course I'm going to make it. I feel fine. But just, as everyone says, babies never follow plans
They
that we
don't.
make.
They do not.
Yeah, they never follow them.
No.
So Monday I went to work. Everything was fine. I was checking my blood pressures. They were fine. And I had them
They
kind
weren't
of
fine. They were high.
Oh, they were a little high. Yeah. I'm still in denial at this point. See,
I know.
they were a little high. And so Monday I saw my patients and we had them reschedule my patients for that week to try and squeeze everyone in just in case I did go into labor. And Monday night I get home, I took a shower, and this is the big joke in my family. I blew my nose while I was in the shower. And I saw something like thick go down the drain. This might be TMI, I'm sorry, but I saw something thick and mucusy go down the drain, and I thought it was like because I blew my nose. I was like, oh, it's fine. So I lay down in bed and I feel that my mucus plug came fully out. And I was like, oh no. Um, I don't know what a mucus plug is, but this has to be it because
Yeah.
it's kind of gross.
It's pretty
It's kind of
obvious
gross.
when you see it, right?
Yeah.
So, yeah. So just because you lose your mucus plug does not mean that you're going into labor, right?
Mhm.
So the cervix is the opening to the uterus, and it makes mucus to kind of plug up the hole to keep bacteria from the vagina from getting up in around the baby. So it serves a purpose. But when the cervix starts to open up or loosen up, dilate a little bit, it can no longer hold that mucus plug up in there. So it will come out, and sometimes it's a big chunk that comes out.
Yeah.
If the cervix stays closed and you don't go into labor or stays close to being closed, it can reform a little bit even, and you can lose more mucus plug later. But just because you lose your mucus plug, that does not mean you're going into labor right away. It could mean that it's coming soon, but not necessarily. Yeah.
Yeah, and of course I told John, I said, I think I just lost my mucus plug, and I started Googling it, and I was like, oh, this doesn't mean anything. It could still be weeks from now. It'll be fine. Well, then at 12:05 in the morning, and this was when I just turned 37 weeks on Tuesday. So 12:05 Tuesday morning, I woke up because I felt a huge gush of water coming out of me. And I sat up in bed and I was like, oh no. I knew immediately what it was because, I knew it wasn't pee. It was a lot. It was a lot of
Yeah.
water coming out.
Yeah.
I walked to the bathroom and, trickles of stuff was just coming out water.
Yeah. So, some women, when their water breaks, they do have this big gush and they're sitting in a
Yeah.
puddle of water. But
That's
others,
how it
it's
was.
just a slow, yeah, that's how it was for you. But
Mhm.
others, it can be just a slow leak. The difference between your water breaking and it being your mucus plug is when you get up and walk around, it'll keep coming out if it's your water broken, and it'll kind of run down your leg. It won't stop in your underwear, right?
Yeah.
Because it's
Yeah.
liquid, it's water. It's not that not mucus like a mucus
Right.
plug. Yeah.
Right.
Yeah.
And that's exactly how it was. Every step I took, more was coming out. I actually had to get a towel and kind of put it between my legs and kind of waddle around because it just kept coming out.
Yeah.
I remember calling you and saying,
Yes.
I think my water just broke. And you were like, okay, well, you need to go to the hospital. And I said, no, I have patients scheduled for the day. Can I
Yeah.
just go and see my patients today? Because you hear stories after your water breaks, you could go hours, especially with your first baby. I didn't feel like
Right.
I was having contractions, so
Right.
why
And
couldn't I go to work?
I know. And some people do. Some people, their water breaks and they don't go into labor. But once your water breaks, you should get checked by your provider, whoever's taking care of you. They need to make sure, number one, the baby's head down and not breech. Um, but also, is it really that your water is broken? Also, it needs to be evaluated to make sure there's not meconium fluid, that the fluid is clear. And once your water breaks, a clock starts ticking, right? Because that bag of water is protective for the baby. It keeps any bacteria from the vagina from getting up in around the baby. And even if you're group beta strep negative, if you get tested for GBS and you're negative, you still have lots of other bacteria in the vagina that can get up in there. And the longer your water's broken, the higher your risk of infection can be, right? So,
Right.
and not just an infection for you, which is pretty bad, but also for your baby. So you don't want an infection. So once your water breaks, the clock starts ticking. Now, that doesn't mean if you're not in labor that you have to be induced immediately. Sometimes we wait 12 hours before we start it. I personally like to start it sooner rather than later, but that's a conversation we can have once we've determined that, yeah, it really is your water that's broken. So anyway, I told you to go to the hospital, not to go to work.
Okay, fine, I'll go. And so I woke John up and I said, I think my water broke. I had nothing packed, like I said. So I was literally hobbling around my house with this towel, like tucked between my legs, trying to just throw stuff into a bag. I grabbed like a phone charger, a nightgown for me, a change of clothes for the baby, and that was all that I got in my bag. So I grabbed a towel and I put it down on the seat of the car because John didn't want me to get his car nasty.
Yeah, he likes his car.
He does, yeah. And then we started driving. Yeah. So I really...
You weren't having contractions at this point, right? You were
No.
not feeling contractions.
Not that I knew of.
Feeling fine. Yeah.
And I didn't know what a contraction felt like, so I didn't really know. But I didn't feel any different. I didn't feel cramps like they tell you it's supposed to feel like. So I didn't feel anything like that. As we were driving to the hospital's like 30 minutes from us. And so I sort of started feeling a little bit of cramps, but I didn't really know what if that was just, my stomach. I ate something weird the day before. I didn't know. So we got to the hospital like around 1. And immediately they were like, okay, your it's clear your water's broken. You're staying. And I was like, no, I have patience. Of course, that's all I could think about was everything I was supposed to do that week. But they admitted me. We got there around 1, and they checked me and said I was 1 centimeter dilated.
Oh no, that's far away, right?
Yeah, exactly. I mean, it's my first baby, so I kind of expected that, and I expected to be there for a couple days. Hooked me up to the monitor, and they said they asked me first, are you feeling any contractions? And I said, I don't think so, but I don't really know. And they said, okay, we're not really seeing any contractions on the monitor. And I was like, okay, cool. So,
So did you have a plan, like a birth plan? Did you have like a plan for what you were going to do for anesthesia? Because I'm sorry, but birth generally is a little painful, and I know that you do not like pain.
What do you mean? I have a high pain tolerance. I don't know what you're talking about. No, I'm just kidding. I have the lowest pain tolerance, and I'll admit it to anybody who asks. But I did not have a birth plan because I thought I had 3 weeks, remember?
Right.
I thought I had all of this time. We did talk about it. I know. Moms always know what you should do. So if your mom tells you something, just do it. But they asked me, of course, when I got to the hospital, do you have a birth plan? And I said, the only thing I have on my birth plan is I want an epidural because I know that I'm a wimp. And I know that I don't want to feel any pain if possible. So that's all I know. And I told them, I said, I don't want to wait until it's too late to get an epidural. So I want to get it when I can get it. So, and they were like, oh no, it'll be fine. You know, you have lots of time to get an epidural. And you know, when I was still sitting in triage before I got admitted, I started feeling more cramps. And I started to realize, I think these are contractions. And I remember saying that to John, I think these are contractions. And, you know, we're both in the medical field, and we kind of looked at the monitor, and we kind of felt like there were little bumps where the contraction should be, but, and
okay, I want to say something about the monitors.
Please, yeah, you say it.
Because the external fetal monitor that they strap on you. There are lots of different ways to monitor babies and monitor contractions. But monitoring the contractions, that external monitor, it's called a tokometer. We can make your contractions look really small by making it loose or not putting it on your fundus. We can make it look the contractions look really strong by putting it right on the top of your fundus and strapping it around you really tight. So it does not measure how strong your contractions are. It's just an indication of when they are. Also, women that have maybe a little more cushion on their belly, the contractions will show up smaller, even though they may be really, really intense and painful. So the external monitor does not tell you how strong the contractions are, only when they are. So there you go.
I guess I had forgotten that, or I don't know. So John was looking at it saying, oh, your contractions are so small. You are the biggest wimp in the world. He was like, I think his exact words were, oh, this is going to be a long day if you're already in this much pain. Because, you know, they started getting pretty painful. I was, you know, I had to stop talking when they would, you know, happen. And I, you know, started like, oh, that hurts. And he was like, oh no, we're in trouble. But we got up to our room, and they started getting more painful to the point where like I was like punching the bed rail because they hurt so bad. And John, the nurse, came back in, and I'm really bad about speaking up for myself. And
which is why I wanted to be there.
Yeah. And I wanted you there. And the nurse came in, and I was like, I'm fine. Everything's fine. I'm good. Because I didn't want to seem like a wimp, even though I am. John spoke up for me a little bit and said, you know, hey, when are you guys going to check her again? Because she's in a lot of pain. And she said, you know, we only normally check every 4 hours. And you were checked like an hour ago, and you were 1 centimeter. So we probably won't check you again for another few hours. And that was
And they
it.
probably
That's all
told
she
you
said.
it would take you days and days to have the baby, right?
Exactly, that's what she said. She was like, "I don't want to get you an epidural too soon, because once you have an epidural, you have to lay in bed. You can't really get up and walk around. And I don't want you, if you're here for days and this is your first baby, to be laying in bed for those days when you can
So
be walking
let's
around."
talk about that a little bit, because
Yeah.
women that do get an epidural should know a few things. Number one, there are different types of epidurals. There are some epidurals where you can actually get up and walk around and have movement and have feeling in your legs so that you can move them and not be completely numb from like the chest down. But then there are some where you're just completely dead from the chest down and you feel nothing. So you should talk with your providers and whoever's taking care of you and find out if your hospital offers what they call walking epidurals or less dense epidurals, or maybe if you want the completely dense one where you feel nothing, just make sure that they offer that kind of epidural. The other thing is, when is the optimal time to get an epidural? My opinion on that is when you're in pain, when it's hurting,
Yeah.
because you don't get a discount for waiting to get it later. It's going to cost the same. And if you know that you want an epidural, then just get it when you're in pain, when you're hurting. With an epidural, the catheter is left in. So they place a little plastic catheter into the column of fluid around the spine, and it's left there so that more medicine can be put in. So people always worry if the epidural is going to wear off or wear out, whatever they say. If the epidural is placed correctly and taped in place so that it doesn't move or get pulled out, then you should be able to get continuous medication through that for days. It
Yeah.
should not be a problem. It's only if it gets pulled out or isn't taped securely,
Right.
sometimes it can move or dislodge, and then the medicine's not going in the right spot. So we generally tell people about 3 to 4 centimeters dilated is a really good time to get your epidural, because then by then we know you're in active labor, right? The definition of active labor is painful contractions and cervical change. So if you go from 1 to 4 centimeters and you're hurting, you're in labor. So get the epidural. Another thing I want to say about epidurals is that some women really try not to get an epidural, and that is fine. That is completely your decision. And there are some times when people are in labor for a really long time that they get exhausted. And then sometimes getting an epidural can just make you let you relax, let you get some sleep, and then baby can come down. I find too that in labor, because it hurts so bad, women tend to tense up instead of relaxing. And when you tense, because it hurts, so you tense every muscle. And when you tense up like that, you're actually holding your baby in. You're not allowing it to come down and to stretch your pelvic floor and to stretch that cervix open. So you have to be able to relax to let that happen. And when you're in a lot of pain, that can be really hard to do. So a lot of hospitals offer lots of different options for pain control besides epidurals. I know at our hospital, and there are lots of other things you can do too, right? Like massage, like keeping the room lights dim, like playing soft, relaxing music. Sometimes essential oils can help you just to relax and deal with it. At our hospital, we have nitrous oxide, which is laughing gas, and that works really well, especially in the early stages of labor, to just kind of help you relax, and it takes the edge off the pain so that you can deal with it and get through. And then also IV pain medicine. And because IV pain medicine, it's a narcotic usually, and it goes in your bloodstream. So it also gets to baby. So that can really only be given in early stages of labor. Once you get really close to delivery, which is when the pain is most intense, you really shouldn't get IV pain medicine, because then your baby will come out and not want to breathe. The baby will come out kind of, well, drugged. So baby
Yeah.
won't breathe. So we only use those during the early stages of labor. But you don't necessarily have to stay in bed after an epidural. You can, depending on the type of epidural that's offered at the place where you're going to deliver.
Yeah,
Anyway.
and they offered me IV pain medicine first.
Mhm.
That was what she first said, you know, let's try IV pain medicine before we do the epidural to see if it'll just help you prolong this a little bit so we can push the epidural out. And they did give me some IV fentanyl. It made me a little dizzy, but I was still in a lot of pain. And you know, the nurse could see, she stayed in there with me for a little bit, and she could see how much pain I was in. And she was probably thinking, this girl is such a wimp. but but she did say, hey, you know, if you're in that much pain, really, let's just go ahead and get an epidural. And I was like, yes, please, thank you.
Yeah.
um, and you know, one of my biggest worries was not getting one in time. Um, John, my husband's a CRNA, and so many times I've heard him tell stories about women waiting until it's too late, and then they want it while they're getting ready to have the baby at the very end while they're pushing, and maybe there's not anyone available at that time to come up and do it, or they just waited way too long. So that was one thing I knew I did not want to do. Did not want to wait too long. So I was really lucky. The anesthesiologist at the hospital came very quickly. He was in the room. It felt like 5 minutes, but it was probably like 20 or something. But he came in and went ahead and did it. So I think wherever you're delivering, it would be good to know, you know, are the providers coming from home? Because, you know, if you're there overnight and
Mhm.
your anesthesiologist or CRNA is going to have to come in from home, it's going to take them at least 30 minutes, you know, to get there and get everything
Right.
ready and get to your room. So that might be a good question to ask if you do want an epidural, or even if you don't, because you never know what might change your mind towards the end when you actually are in pain. So
Yeah, so
my
don't wait till the last minute to ask for that epidural
yeah,
if you think
don't
you want
wait.
it. Yeah.
Yeah, my anesthesiologist came very quickly, and I was really thankful for that. Um, you know, when he came in to give me the epidural, I was not nervous at all for the epidural. A lot of people were asking me, "Hey, are you nervous to get an epidural?" And you know, initially I might have said yes, but I was in so much pain in that moment that I wasn't nervous to get it. I was really excited and ready for it. But basically, they had me sit up on the bed and kind of lean forward and bend and curl. Um, and over they say like you're curling over the baby, or I've heard people say like a cat, like
Mhm. Arch
a
your back, yeah.
Halloween cat, you arch your back like that. And that kind of lets the bones in your spine open up so that they can easily get into the space that they need to get into. And first they do a little lidocaine to numb the area, and that's probably the part that hurts the most, just a small sting. But honestly, I don't even remember that part at all. And then they go in with a larger needle, but it's still a pretty small needle, into
It's
the
just
space.
long. It's thin but long.
But long, yeah. But it's very thin, and with the lidocaine, I didn't feel it at all. And then we're able to get into the space and give me the medication to help with the pain. Um, yeah, it
So this was
kicked
like
in pretty.
3 in the morning, 4 in the morning, something like that?
Yeah, yeah, it was 3 or 4 in the morning, and, you know, it kicked in pretty quickly, which was really nice. There was a few spots that were still painful, which was really strange. Like, the pain in my left leg was completely gone, but my right leg like, on my thigh, I could still feel it really strong every time I would have a contraction,
Huh.
and that part of my leg would shake, um, because it was still hurting, and I told the nurse, but the nursing staff was really great. They kind of directed me how to turn a certain way to make the medication fall to that side, you know,
Right.
using gravity to kind of push the medication that way. So after about 30 minutes of flipping over like a rotisserie chicken or something, um, I had the pain in that area did end up going away, and I didn't have any pain at all. I've heard of some
Good,
people having hot spots, but I didn't have anything like that.
good.
But I feel like even if you have a hot spot, which is I think what I was experiencing, it was a whole lot better than the pain I was feeling before. the
Right.
epidural. Yeah. The only thing I could really feel was a lot of pressure, like around where my butthole is, for a lack of better term. um, right where my anus is, I felt a whole lot of pressure right there. But that was really it. Everything else was pain free. It was really, really nice. After I got the epidural, the nurse came back in to check me. And she actually was like shocked, had this like shocked look on her face, and was like, I'm gonna go get someone else to check behind me. And I was like, okay, I don't know what that means. Another nurse came in and said, oh yeah, you're 7 centimeters. So I went from 1 centimeter to 7 centimeters in 3 hours in my
Yeah.
first baby.
Yeah.
So
So an average first labor, from the time you actually start the painful contractions until you deliver a baby, on average, it's about 12 hours. So we're talking you went from 1 when you were not in labor, not feeling contractions, to 7 in under 4 hours. So that is pretty fast. Don't expect that. Everyone should not expect that. And I think the nurses were not expecting it, right?
No, they were really shocked. Actually, the one nurse said, I've never seen anyone go that quickly before. But it made me feel better to know that,
Yeah.
like I was in all that pain and it wasn't for nothing. Like I was actually
Right.
doing
You were
something.
really in labor. It was true
Yeah.
labor. Now, sometimes a second or third delivery can go really fast like that, but it is a little bit unusual for first to go that fast. So that means your next one might be even faster, Rachel. Watch out.
Oh no, I'll be a parking lot baby.
Yeah. Yeah.
Um, but yeah, after the epidural, I was finally able to rest and get some sleep, which was really, really nice. And they came in and they said, if you feel like you have the urge to poop, let us know. And I was like, oh, okay, I don't know. I don't know that
Yeah.
I'll feel that, but I did feel a lot of pressure down there.
Yeah.
They came in about 2 hours later and they said, oh, you're 10 centimeters. You're ready to push. And I was like, oh my gosh, what is happening? It really all happened so fast, but everyone was so great. And they really told me how to push. I didn't have to know. I didn't have to know anything. They really told me and directed me on what to do. And they gave me different positions to push in, which was really nice.
Yeah, that's awesome. So,
Mhm.
yeah, there are lots of different positions that you can push in, and some people just feel more comfortable pushing in certain positions. But sometimes your provider may tell you that may want you to move to a different position just because the baby's head may be coming out in a way that might not be the correct way, or the easiest way to get the baby out. Sometimes if the baby is kind of crooked a little bit, we turn you to the side. Some people do really great pushing on hands and knees or in a squatting position.
Mhm.
And But then there's the pubic bone. So sometimes when you're up in a squatting position, you're actually pushing the head into the pubic bone, and we need to get the head to come under your pubic bone to come out. So then sometimes laying back in the bed works better for that. There's a big push now among all the natural childbirth people to let women deliver in the position that they feel most comfortable. And that is fantastic. We do that. But if a woman's pushing for a really long time and the baby's not coming out, they're getting tired. Often when the midwife or physician, in my case, checks the patient, we can tell where the baby's getting hung up, and we can offer a solution for a way to push that's a little bit more effective at getting the baby to be in the right position and come out. Sometimes babies come out facing up, sunny side up, and sometimes your provider can even help encourage the baby to turn their head to the right position. A lot of times as you push, the baby turns their head automatically to come out in the correct position. But if they don't, sometimes we can kind of nudge them or encourage them to turn a little bit.
Yeah.
Anyway.
Yeah, and one thing I noticed is towards the end, they started having trouble keeping JJ's the baby boy, his name is JJ, or that's what we call him, his heart rate on the monitor. The external monitor wasn't really able to pick up as well. And so they were trying to turn me in different ways and put me in different positions to kind of get his heart rate on the monitor better. And then when they did get him on the monitor, his heart rate wasn't really recovering very well after the contractions. So normally you have a dip in baby's heart rate with the contractions as you're pushing to get him out. And his heart rate wasn't coming back to what it should, which is concerning. And so they were trying to put me in different positions to see if his heart rate would
Yeah.
recover better in different positions as well.
Yeah, so some babies tolerate labor better than others, but you can imagine when your uterus is contracting really strong like that and you're pushing really hard, that baby's getting squeezed. And the
Mhm.
blood flow through the placenta is not occurring when you're having a really strong contraction and when you're pushing. So your baby's effectively holding his breath while you're pushing. And sometimes they don't tolerate that very well. And if the baby's heart rate goes down with a contraction, as long as it comes right back up afterwards, that's generally fine. That can sometimes mean the head's getting squeezed, or sometimes cords getting squeezed. But if the baby's heart rate goes down and then takes a really long time to come back up, that's considered a late deceleration and can mean that the baby's not getting enough oxygen. So that's when we start to worry a little bit, right? Because low oxygen can really affect your baby. Oxygen's important. Yeah.
Yeah. So they came in and they were kind of discussing options with me, and they said they were probably going to put a fetal scalp electrode on. And, I knew what that was.
Yeah.
And so it made me very scared and sad. Basically what it is a little metal hook that they hook into the baby's scalp. And that way they can monitor the baby's heart rate directly from the baby's head, as opposed to from the outside. So, from the outside, there's a lot of things that can affect if you can hear the baby's heart beat. But if you're going directly from the head, you're going to get a better reading on his heart rate. So I knew that, they were thinking of doing that. And it makes me sad because it does go directly into the skin.
Yeah, but it's just
And
like if you can imagine, you can put a needle under the skin of your
Mhm.
finger and it doesn't really hurt if it's just in that skin layer. So that's kind of
Yeah,
where the scalp electrode goes. It doesn't go into the bone, but it
yeah,
does go into the skin. Yeah.
yeah, it goes into
And
the skin.
trust me, your baby's head is already being traumatized by being pushed against your pubic bone.
Yeah, of course. But,
Yeah.
it's my baby, and so it made
Right.
me
I
sad
know.
and
I know.
scared to
I
know that
know.
he was gonna have something stuck in his
Yeah.
skin.
Yeah.
But, ultimately in the end, it ended up being really fine. He had a tiny little cut on his head. It healed in a couple days, and I was pushing on it and, seeing if he was feeling pain around that area after he came out,
Yeah.
and he didn't.
Yeah.
He didn't even flinch when I was pushing on it. So, I'm glad that they ended up doing that, because after they placed it, I could even clearly hear his heartbeat, his heart rate, as we were having contractions and during the whole labor process at the end. So it was definitely a good idea to do it.
Yeah. So,
um,
monitoring fetal heart rate monitoring is also a lot of the people that advocate for more natural childbirth don't want to
yeah,
monitor the baby's heart rate as much, right? Um, and in a low risk normal pregnancy, intermittent fetal monitoring is absolutely okay. And you can just listen with a Doppler. And as long as you're not hearing decelerations, that can be okay. But most of us know that when you're pushing, and you were not a low risk patient, you were a high risk patient. So fetal monitoring was indicated continually for you. But also, when a patient is pushing, that's when it's the highest chance that the baby's not going to tolerate it well. That's when we're going to see be more likely to see changes in the fetal heart rate that can indicate bradycardia, where the heart rate's just too slow for too long, and then the baby's not getting enough oxygen. So monitoring the baby's heart rate helps us make decisions about, is it safe to keep pushing, or do we need to jump in and do something to get the baby out quicker? There are different ways to monitor. You can monitor with just an external Doppler where you just listen intermittently, which is only for low risk pregnancies, not for high risk pregnancies. Most people will have a little band around their belly that attaches to these round transducers that pick up the heart rate through the mom's abdomen. Now that type of monitoring, it can sometimes inadvertently pick up mom's heart rate instead. Or if the baby moves to a different position, then the heart rate's not being picked up anymore. So it's harder sometimes to keep the baby on the monitor, especially when you're changing positions and when you're pushing. Yeah, that just changes a lot. Now, there are some external fetal monitors that are wireless and cordless, so you don't have to be attached to a big machine next to your bed. One that we use at our hospital is called the Novi, and it has little stickers that go on your abdomen, and it sends by Bluetooth the heart rate to the monitor. So you still see it on the monitor. It still prints out a little tracing on a strip, but you're not attached to anything. You don't have any wires or tubes. You just have little stickers on your belly. So that's really nice. The scalp electrode, however, it will monitor continuously. We're not going to get interference by mom's heart rate. It's not going to matter if you change positions. It's not going to matter if you're pushing. We'll be able to see the heart rate all the time so that we're making the best decision because we have the best information, right? If you have bad information, you can't really make a good decision. So this just helped your doctor get the right information that she needed.
Yeah. And it worked really well because even I could hear his heart rate as I was contracting and pushing, and I could hear that he was kind of recovering better. His heart rate was coming back up after contractions better, and it was kind of nice. However, in between contractions, there wasn't great variability, is what my my OB was telling me, and you can talk more about that.
Flat,
yeah.
When the heart rate is flat like that, that can mean that not enough oxygen is getting to baby. So that's what they were worried about.
Yeah. So my doctor came to me and said, we're not seeing a great variability. I want to attempt to use a vacuum to get him out. Well, basically, we need to get him out quickly. So we're going to try a vacuum with the next 3 contractions. If we can't get him out in the next 3, we will probably have to talk about going to do a cesarean section. And this,
they told you have 3 chances to push your baby out, right?
That's what they basically said. You have 3 chances. And I think she probably didn't mean it that way, but that's how I took it. And so it made me very determined. I'm going to get this baby out. I didn't get this far to go have a C-section after that. So I gave it all I had. Before I was like, I don't want to get a hemorrhoid or I don't want to poop on the table. So I'm going to push just a little bit. But once she said that, I was like, nope, I'm pushing with everything I got. And he was out in 2 pushes. So we did it.
Good job, Rachel.
But my doctor was really great about teaching me how to push, and everything worked out, exactly how it was supposed to. So I wanted to say a couple things about things that I learned from this experience. Overall, it was a really, really great experience. I know I was very lucky and blessed that I didn't have more things go wrong. But the lessons that I learned is, one is to advocate for yourself. I am really bad about this. I don't want anyone to know that I'm in pain or that I'm uncomfortable. I don't want to inconvenience someone else just so that I feel better. So I'm really bad about that. But in that moment when I was in so much pain and having those contractions, and I really wanted an epidural, but I didn't want to show pain to the nurses as they were coming in. Thank God I had John there, and he was like, you need to tell them you're in pain. You need to tell them that you're punching the bed rail because you're in so much pain. And so, really advocate for yourself. And it's not saying, I don't trust my doctor, I don't trust the nurses, so I'm advocating for myself. It's not like that at all. It's just telling them what's going on with you and how you're feeling so that they know how to better take care of you. And, when they tell you, hey, it's your first baby, you're going to be in labor for days. So most of the time we don't do an epidural this early, or most of the time we don't check your cervix until every 4 hours. They're just telling you, so that hopefully you'll feel more reassured. But if you really feel like you're in pain, don't feel like they're blowing you off or brushing you off or anything. Tell them, hey, I really am in a lot of pain and we should do something about this.
That's really good advice, Rachel, because deliveries are very different. Everyone has a different experience. And just because the nurse expects you to take days to deliver doesn't mean you have to. And some people go faster and some people go slower. And that's just the way labor is. Yeah. So
Yeah.
that's important. Yeah.
Yeah, and I think them saying, "Hey, most of the time the first baby takes days," and I don't think they were brushing me off or saying you're crazy. I think they were just trying to reassure me that, hey, maybe you don't want to get an epidural and these are the reasons why. But if you feel like you really want it, hey, I think it's a discussion that you should have. So yeah, that's one thing. Another thing is being very flexible. And I know everyone says this. This is what everyone
So
says about
true.
labor and giving birth. But I feel like I'm not a person who has to have everything planned out. But in this instance, even the littlest thing, like, okay, I feel like I have 3 weeks and now I only have 5 days.
Now you only have
Just
one.
now I only have one day. Now I'm going to the hospital right now. um, it's great to have a plan, but just be okay with it not going the way that you plan. And also, just because the something is the way that usually things go, like usually with your first baby, you go to 40 weeks, doesn't mean that's how it's going to go for you. So don't expect that for you.
That's really good advice too. Yeah.
Yeah. And everyone says that, and you feel like you know that, but in the end, if it doesn't go the way that you plan, it kind of shocks you for real.
Right. Now, I want to say
um,
something about birth plans because I think having a birth plan is really important because that means you've thought about what you want. You've taken time to consider the different options. Maybe you've talked about it with your partner. But even though you have that plan, and talk about it with your doctor, your midwife, whoever is taking care of you, of course. But even though you have that plan, just know that things don't always go the way we plan. And my plan in any labor is that when we're all done, we have a healthy baby and a healthy mom, and that's all. Everything else can be up to you. But as soon as something happens where it's no longer on the normal trajectory, then we need to talk about what options there are. What can we do to make sure you're okay and your baby's okay? So just to
yeah.
have an open mind and yeah.
Yeah. And I think trying to think of things in the positive light instead of the negative, that's one thing I really tried to do, in saying that, yes, maybe I didn't have those extra 3 weeks to prepare, but my baby was smaller.
Yeah.
So I was able
You
to
can
have
push him
them
out
back.
faster.
Yeah, because I think if I would have gone the whole 39 weeks, I would have probably ended up having a C-section because he was 7 pounds, over 7 pounds at 39 or 37 weeks. So just trying to think of the positive things, cup half full type mentality is always good. And the last thing that I really wanted to say is be ready early. Get your stuff together early rather than later. Make sure you have
Yeah.
your bassinet open, even if you feel like you have 3 weeks. And people told me this and I didn't listen. Put your
I
car
told you
seats.
that.
I know, everyone told me. Put the car seats in the car so your
Yes.
husband doesn't have to go back home after you've had the baby and try and figure out YouTube how to put the car seats in the car.
He did a fine job. It was in there
He did great.
appropriately.
He did great, yes, but he was gone for a while. And then have your hospital bag packed very early. And everyone tells you this, and I did not listen, but you don't want to be throwing stuff in a bag while you're dripping water and having to hold a towel between your legs. And I think one other episode we really should do is talking about what to put in your hospital bag because I heard so many different
Mhm.
things said about what you should and shouldn't have. And I'd really like to talk about what was helpful for me and what wasn't helpful for me in the
That's
hospital bag
awesome.
that I didn't really have packed.
That's awesome. All right. Well,
But yeah, that's kind of all the lessons that I had. And I'm sure I'll think of more later, but anything
yeah.
else
Well,
you can
Rachel,
think of, Mom?
no, just thank you for sharing your birth story with us. That was really fun. And JJ is the cutest little man. Oh my
He's really
goodness.
cute. I know. Maybe he'll make a guest appearance one day.
Yeah, he has to one day. Yeah. Gets a little bigger. He's
Yeah,
pretty
yeah,
cranky
yeah.
now.
He's very cranky right now.
Great. All right. Well, I think that's all we have for this day. So I I hope you all have a wonderful rest of your day, and thanks for joining us on Mama Doc, Baby Doc.
Thanks. Have a good day. Bye.
Bye.